Hi everyone, I'm Erin.
I'm Rashelle. Welcome back to our YouTube channel.
We're going to continue our conversation focusing on providers, addressing our comments to those healthcare team members who are working with interpreters in their appointments with the patients.
And we want to talk a little bit and dig into a little bit more to when you're in the room with the interpreter, regardless of modality, if they're on-site, video, telephonic, but what can you do as a provider to support the interpreter in their role? Because as the interpreter role, people come to understand it more and more and more, it can still seem a little elusive. So as a provider, you have the interpreter there. What can you do to support them so that they can support you?
So the first thing that we want to plant as an idea is to approach the situation that you are the interpreter's ally in communication. You all have the same goal, the same idea in mind, and that's the best possible care for the patient. So keeping that information in mind, consider what can you do then to be the interpreter's ally in communication and helping in communication to flow well throughout the encounter. One of the more challenging situations for an interpreter to deal with is when there is a bilingual individual who's accompanying the patient, or maybe another bilingual staff member who's in the encounter, and sometimes that can get a little bit contentious. Sometimes the patient or the family member might not want to work with or have an interpreter present. Sometimes the bilingual individual can be a little bit aggressive or judgmental, or somehow kind of want to push the interpreter out of the scenario. And we can certainly address the pros and cons of working with family members instead of a professionally trained interpreter in an encounter in a separate video, but sharing the value of having a professional interpreter instead of working with or using a family member to facilitate communication. Let's just assume we're on the same page with that for now. But encourage the family members, encourage the patient to give the professional interpreter a try. Like, don't just start with the assumption that we don't like the interpreter, they're not going to do the job well, or whatever the reason is that that's very for them. But encourage the other parties in the room to allow the interpreter to bring their expertise and their training into that communication, and don't place that pressure on the interpreter to be the one to have to encourage people to work with them. So you have a very powerful and influential voice, and helping the family and the patient to feel comfortable and confident in working with a professional interpreter can go a long way when they're hearing that you're the one who really wants to work with that professional interpreter.
Right. And the interpreter that you are working with is there for you. They work for you, the provider, for your organization. You're the client. In a setting like this where, the spouse comes in and they speak Spanish and English and they want to start interpreting, they're really doing it because they want to make sure that everything is said, and they want to take care, and they want to show their skills. But encourage them to be the family member, to listen, to be the advocate, and to participate as that family member, and allow the interpreter to do the job of interpreting. Because really, in that scenario, if you are a bilingual family member and you're trying to do the interpreting, your mind isn't able to be the patient advocate at the same time. If you think of you going to an appointment with your family member, you're there to support them, to understand, to hear, to listen, to explain things, make sure they're not missed, to support. It's its own role within the encounter. And so assuring you, the provider, by being point guard and letting everybody know where they sit and what their role is, you really are in charge. And that's what the series is about, is how do you take charge of the situation and being an ally with the interpreter and setting them up for success, so that they can help you be successful, which then brings that successful outcome to both the patients and their families.
One of the key points in achieving successful communication within the encounter is the concept of turn-taking. Turn-taking in communication happens all the time, even when there isn't an interpreter involved, but it's especially important to be proactive and strategic in managing the flow of communication when there is an interpreter involved. Now, little sidebar, interpreters do have, as part of their code of ethics and standards of practice, the expectation that they will manage the flow of communication. But that is so much more effective and so much easier to do when you, the provider, are also mindful of the importance of turn-taking in communication.
If you have family member, patient, yourself, another provider in the room, and the interpreter's job is to make sure that everything being said is communicated effectively. And so the interpreter is then being the voice to 2, 3, 4, 5 different people in the room, and it does require people to take turns. So in that sense, It is different than a non-interpreted encounter because when everybody speaks the same language, you can kind of interrupt and interject and all of that. But as the provider, if you understand the importance of the turn taking so that the interpreter doesn't miss different things that are being said, or if you, the provider, have a lot of interruptions coming from somebody and the interpreter is having a difficult time kind of getting that in, that falls on you then to manage that and speak to that person in the room and communicate how you feel that's affecting your job in treating the patient and achieving the goals and the objectives of the encounter. So again, you are in charge of the encounter, and so keeping in mind the turn taking and facilitating the use of an interpreter and promoting that in its role specifically is really important.
The last point that we'll share on this particular topic is encouraging questions and clarification. Don't be surprised if the interpreter needs to clarify what is a voiding cystourethrogram so that they can interpret it accurately into the target language, or if the interpreter needs to ask other clarifying points on something that linguistically wasn't clear or what have you. So don't be afraid of an interpreter who is asking for clarifications and questions. Maybe even proactively say, if there's anything that I say that you need me to clarify so that you can interpret it effectively, lay that as a welcome and an encouragement to expect and know that clarification and questions will be necessary at different points throughout the interpreted encounter.
Mm-hmm. And a lot of that too will depend on both the complexity of the vocabulary but also the duration of the speaking. A good example is you're giving directions at the end of an appointment of what medications to take, what to do for the fever, what foods to do, a rice diet, all of these different things, and it's a long list. Don't be surprised if the interpreter interpret A, B, C, D, and then they come back at you and say, you said E, F, G, right? Yep, okay. And so in that clarification, an interpreter should make you aware that that's what they're doing. So it should always be, I need to clarify something with the patient, or I need to clarify something with you, so you'll know what's going on. But welcoming that into the environment, knowing that it is a necessary step, is really important, and it'll go a long way, again, in allowing you to take control of the encounter and allowing the interpreter to help you be as successful as they can.
So we hope these 3 nuggets, these 3 tips, these 3 ideas have been helpful for you in making sure that the encounter is the most successful possible, focusing on communicating effectively through and with and partnering with interpreters.
So if you have any comments, be sure to share them below. Be sure to like the video. We'd love to continue the conversation. How have your experiences been working with interpreters? We look forward to hearing from you soon. Have a great day, everybody.
Take care now.